Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I'm specialized in facial rejuvenation, minimal invasive procedures, and today I'm going to talk about anatomical factors that make a face beauty. This is my curriculum. We can see this face and we said it's nice, it's beauty. But what are the factors that make this patient beauty and others not? If we talk about the upper periorbital area, there is an interrelationship between the eyebrow and the upper eyelid. It's very important that the tail of the eyebrow is over the head in this line and over the orbital rim that is here. And in the lower periorbital, we can see there is no distinction between the lower eyelid and the cheek area. These cheeks have voluminization. From the antique Egypt, we can see they have the same value of aesthetic. We can see the eyebrow over the orbital rim and over the tail, over the head, the voluminization of the cheek, and no point between the lower eyelid and the cheek. Just look like an unique unit. Because we can say there is no lower lid cheek junction. No lower lid cheek junction. It's like all an unit, unconvex unit. So also we continue the same, and you can see here the same. The tail over the orbital rim, a volumization of the cheek, no point between the lower lid and cheek, no point of junction, just like unconvex unit. The same. But here we can see the tail of the eyebrow is in a nice position, is beauty. Here after years not. It's more important in the aging process, the dropping of the eyebrow, that the upper eyelid flaccidity. For this reason, I'm against of removing skin here, because we accelerate the aging process, dropping down the tail. And here we can see the lower lid cheek junction is here, and now is here. Also this have this sadness, this somber expression, because from when he was young, the tail of the eyebrow is under the head, and here you can see no voluminization of the cheek and the lower lid cheek junction. The lid cheek junction is here, but now it's better because someone voluminize the cheek. He need to come to Argentina to perform a endoscopic brow lift to reposition the tail of the eyebrow, and also laser to remove the wrinkles. But the cheek now is better than when he was young. But this is beauty. Is all the same. No lid cheek junction, just is like a unit between the lower eyelid and the cheek, with good voluminization of the cheek. This voluminization of the cheek produces an harmonization of the face, because it's according to with the chin and the maxillary jawline. All the same. this young patient have not a face of beauty in this area because have lower eyelid fat pads, but also have lack of volume in the malar area. This is ethnic, and all the patient come looking for a blepharoplasty. This blepharoplasty that I perform without scars, without removing skin. But many patients don't understand the importance of volumization of this area, because if I give volume here, I'm shortening the distance of the lower eyelid. You can see here a tear through in a young patient. The lower eyelid comes here like a short V, but this patient understands the importance of volumization of the cheek, and here I shortening the lower eyelid. But this patient needs more fillers to improve her beauty. Here we can see the difference. And this patient comes to perform from another country to perform this patient performed a blepharoplasty in another country, and the plastic surgeon sent to me to perform a carbon dioxide laser rejuvenation in this area, because conventional blepharoplasty lack the ability of improve all the skin of this area. But in the first step, I improve all this area with volumization of the cheek. Here you can see lower lid, the lower lid cheek junction is here, and you don't see lid cheek junction because it's like all an unique unit. Is convex, and the lower eyelid continue with this. How improve here the zygomatic arch, and how it is possible to bring to this patient in 20-minute procedures this beautiness. You can see here no zygomatic volumization, and here you can see a nice volume, lower lid cheek junction here, and there is no lower lid cheek junction. It's the cheek and the lower lid like just one unit. The importance of to feel not only the mid face but lateral to the zygomatic area to give this nice volume that we saw in the previous pictures of the Egypt and the model today. And another cases is patient that come to a facelift or face rejuvenation. All they come to perform my personal technique of blepharoplasty without removing skin, tightening with carbon dioxide laser. But all of them lost volume of the malar area because in the aging process, generally we lost volume here, and is necessary to improve this area, give this volumization. And you can see here a lower lid cheek junction, and here you almost don't see where is lower lid cheek junction. It's just like a unit. The effect of carbon dioxide laser tightening, nobody removed this area, this malar festoon. Generally they resect the skin here, but with carbon dioxide laser tightening and volumization this area, we can this natural result. Also reposition of the eyebrow, This patient goes to many plastic surgeons and all suggest a skin resection here. You can see this belongs to the eyebrow skin because it's thick, and if they remove skin here, they push the eyebrow down. Here with endoscopic, I reposition the eyebrow over the orbital rim. You can see how I can improve this with endoscopic brow lift, with carbon dioxide laser, with my personal technique of rejuvenation, the periorbital area without skin resection, and I improve all the skin in this area. Another patient with the same, my personal technique of blepharoplasty, endoscopic brow lift, volumization of the malar area, and vertical oval is elderness, and this is youthness. This redness, this red line from here to here means that I never remove skin, I never left scars in this area. I rejuvenate all the area with endoscopic, with volumization, with carbon dioxide laser tightening. And the patient is very complicated. How I can improve all this area without removing skin? I perform the same procedure, reposition, tightening, volumization. For this technique, I have international recognition from my peers. Many doctors around the world come to my clinics to learn this procedure, but a lot of patients fly around the world to come to my clinic to perform this procedure. And this is what I'm doing. And the point here is, what are the anatomical factors of beauty? You can see improving the quality of the skin, reposition of the eyebrow, tightening the skin, and volumization of the malar area. This patient was operated in another center. We can see the sadness of the expression because they resect the skin of the upper eyelid and also resect the skin of the eyebrow. For this, and you can see the lower lid cheek junction, and here the reposition and improve the skin with carbon dioxide laser. Another case is operated in another center. You can see how a thin strip here with conventional blepharoplasty, it is impossible to rejuvenate all this area, but also produce a malposition of the lower eyelid with exposition with the eyeball and a damage of the eyeball. Okay, you can see. And also in young patients, my personal technique of blepharoplasty and malar volumization. Almost this chapter is to understand to the patient the importance of malar volumization in order to shorten the distances of the lower eyelid and improve the balance of the face, giving volume to the malar area. Young patients for ethnic factors have lack of volume here, and when we get elder, we lose of volume. And almost all the patients need malar volumization. Not all, but most of them. I hope this video is useful for you at the time you need to choose a procedure for periorbital rejuvenation. And I wait for you in Buenos Aires, Argentina. You can send me pictures, your name, last name, where you live, pictures, and I'm going to analyze. And if you are agree, we are going to send you the preoperative studies, and you fly directly to perform this kind of procedure. Have a nice day.